This is one of the difficult questions in our debates, and the reason is because now molecular genetics becomes more and more important, also in selecting patients for transplantation or for non-transplant approaches. And myelofibrosis is a disease which usually is very heterogeneous. So you have patients living 20 years, others live only for 10 years or for 2 years. And maybe molecular markers would help to select patients for stem cell transplantation. And here we have several high-risk markers like ASXL1, P53. And in the discussion we will show that the markers alone will be not a sufficient indication for stem cell transplantation, but in combination with other clinical markers or other clinical disease-specific risk factors. So as I mentioned before, the molecular markers becomes now more of interest also in myelofibrosis. And there we know there are several high-risk molecular markers. And this is the ECH2, this is IDH1, IDH2, P53 and ASXL1, for instance. And if patients are harboring one of these mutations, then the risk of dying is getting higher. So we have several risk scores like the molecular marker score, where one of these factors are included. And currently, these risk factors are also an indication for going for stem cell transplantation as the only curative treatment approach for these patients.